This is Ward 9D at Tan Tock Seng Hospital today. On April 28th, it was reported that a nurse deployed on the ward had tested positive for COVID-19. The case was the first of a cluster that now stands at 46 people, including staff, patients, and their close contacts. 3 weeks after TTSH stopped admitting new patients and barred visitors, except for critically ill patients, the hospital is now reopening to new admissions and measures are in place to provide greater protection. The affected areas have been deep cleaned and new specialist equipment has been installed. Ultraviolet and hydrogen peroxide vapor is used to deep clean and decontaminate the wards. Ventilation and air purification within the wards has also been improved by introducing exhaust fans and portable HEPA filters. Patients will be limited to one pre-registered visitor a day, and each visit will be limited to 30 minutes a day. Visitors must continue to be masked and no eating or drinking is allowed during the visit.
So I think what gives us the confidence to reopen is the fact that we've been doing fairly regular testing in the inpatient setting in the last 3 weeks, and we have fortunately not found any new infected patients or new clusters of patients. Even from the first day when we discovered the first patient, we had already come up with fairly stringent isolation procedures.
To prevent another outbreak, staff will now have to undergo routine rostered testing at regular intervals. Tan Tock Seng has also stepped up their requirements for personal protective equipment for the staff. Aside from physical health, the staff's mental well-being is also taken into consideration.
Healthcare workers, medical staff, they tend to be pretty stoic, and you don't know what's going on in their mind. You don't know the concerns that they have, not just their personal safety concerns, but also the concerns of their other colleagues around them, family members, the risk of bringing the infection home to the family and all that. So I think it's been a multi-pronged approach in trying to ensure that all safety measures were put in place, not just physical safety, but also psychological safety.
While Ward 9D reopens, the repercussions of the TTSH cluster are still being felt. It was announced on May 20th that an elderly man linked to the cluster had died from complications related to COVID-19. Azim Azman for The Straits Times.